Hello, everyone, and welcome once again to the Cancer Conversations by Delarc Pharmaceuticals. Today's conversation is something that honestly feels a little worrying. Why? Because this is something that we're hearing far more often now than we did a few years ago. Breast cancer in younger women. Earlier, breast cancer was mostly associated with women in their 50s or 60s. But today, we're hearing about women in their late 20s, 30s, and even 40s being diagnosed. And naturally, it raises a lot of questions. But the question is, why is this happening? Is it lifestyle? Is it stress, genetics, delayed pregnancies? Or is it simply that we are detecting more cases now? And beyond the medical side, there is also an emotional reality to it, isn't it? When a young woman is diagnosed with breast cancer, it affects every part of their life, be it career, be it relationships, confidence, future plans, just about everything. So, today we are going to make a very honest and a very meaningful conversation around this same topic. And joining us for this discussion is someone who has an extensive experience in treating breast cancer patients and guiding families through these journeys. Dr. Mubeena. She is a breast cancer specialist, and with years of working with young patients, she is here with us to help us understand what really is happening. Dr. Mubeena, thank you so much for being with us over here today. There are so many questions, there's so many myths, there's so much that we need to talk about today. Though I have a list of questions, I think we'll begin with that and then let's see how it goes ahead. Firstly, are breast cancer cases really increasing? Or do you think it is just that now that the awareness has increased and that's the reason the screening process is increased and so we're getting to know?
It's a good question, Ekta. Actually, it's elephant in the room. The problem is huge. Yes, breast cancer is the most commonly detected cancer now in India, not just worldwide. Amongst all the cancers, it tops the chart, surpassing head and neck cancer. So actually, we are seeing more and more number of breast cancer cases. So if you compare data, in the 2000, every year 80 to 90,000 cases of breast cancer were diagnosed in the initial 2000s.
Oh, wow.
Now in 2022, the last data which we have, Globocon, so the incidence has risen to close to 1.9 lakhs. So that is double, more than the double from 2000 to 2022.
Yeah.
So if you would combine all cases together, then breast cancer has 24% incidence. Like if you have 100 different cancers, like including head and neck cancer, lung cancer, ovary, cervix, and all the sexes combined. So 24% is very big number.
It is huge.
And amongst the females, again it tops, and there is for 12 to 14%, breast cancer.
So, from your own experience, have you also noticed a shift in the age of people coming to you?
Yes. So India is, since it's an emerging economy, so we see more women coming with breast cancer, more young women coming with breast cancer.
Okay.
50% or, such women are younger than 50 years of age.
Oh, wow.
Yeah. Whereas in the Western countries, the age what they see commonly breast cancer is in their 60s.
Okay.
So India is seeing more young women having breast cancer, which is actually alarming. We see actually girls as young as in their 20s, in their 30s. So this is a very different trend compared to the Western population.
Yeah, it seems like a matter of concern. Do you see a reason to this?
Yes. So also there is an urban-rural divide,
Yeah.
because there are registries, cancer registries. In urban cancer registries, that is Delhi, Mumbai, Chennai, what they have noticed is 1 in every 22 women can have a lifetime risk of breast cancer. That is, if you follow a lady from her beginning 20s to like 70s, so such women, if you follow 100 women, so 1 out of every 22 such ladies can develop breast cancer anytime during their lifetime. That's a big number.
That is,
Whereas there are registries in rural areas. There is a place called Barshi in Maharashtra. So the registries show that the risk of breast cancer in rural women is 1 in 60 to 1 in 80.
which is still,
Yeah, I mean, look at the divide. I mean, it's very different. That's because of a lot of factors. Uh, Urbanization, westernization of food, having ultra processed food, environmental risk factors, stress, obesity, sedentary lifestyle, alcohol consumption, and then reproductive factors like urban women have very different lifestyle compared to a rural lady. Having first childbirth at a later age after 30s, and then having less number of children and not breastfeeding children or breastfeeding for a brief period of time compared to rural women who get married early, have their first child in their early 20s, have multiple children, actually breastfeed for longer period like 2 years, 1.5, 2 years. So that is very protective.
right.
So these things actually have created divide. Also, urban women have more access to healthcare. There is more awareness, more screening. So you end up seeing early breast cancers in urban women. Whereas rural women actually are a little skewed because they're not aware, they don't seek medical attention, and the infrastructure is not great. The healthcare infrastructure is not great in the rural areas. So they don't have screening mammograms in very rural pockets. Also, there is stigma of getting your breast exposed in rural women. Awareness is not there. So they probably may not be coming forward for screening even if they find a lump, for diagnosis rather. So that has also created a divide.
Yeah, I was just going to ask about the stigma. That could also be a possibility.
Yes, very much.
So when you just mentioned that in urban areas, the age bracket has now come down to maybe early 20s. But
Not very common in 20s, but what we see is 30s and 40s, there is a lot of patients. There are a lot of patients. If you see 100 patients of breast cancer, 50% of them are younger than 50 years.
So considering there are like these very young cases, do you think that when they see the symptoms, they initially ignore it, thinking that maybe I'm just too young to have breast cancer? What would you say to these women?
Yes. So actually awareness, young women feel that, okay, this must be just a lump related to my menses and can ignore, thinking that breast cancer is a disease of elderly, right? So it's not true anymore. Most of these ladies should be aware that any painless lump, first and foremost, painless lump, if they notice, please seek medical attention. Do not ignore any lumps in the breast.
Right.
Yeah. Also, young women have fatty breast tissue, dense breast tissue.
Yes,
Very
these
dense
days.
breast tissue. So, at times, by the time they notice and seek medical attention, it's already, stage 2 or 3.
Right. So it's very late. So ideally, no matter what your age, you should always get
You
it
should
checked,
always get it checked.
Right. So there should be no age bracket that, okay, maybe earlier people used to say that after 30s you should start getting a mammogram done at least once a year. But now I don't think that is.
No, the guidelines still recommend screening for breast cancer with the mammogram after the 40s every year, not before that. Because, as I said, the dense breast tissue which young women have, mammograms are not very sensitive to pick up dense breast tissues.
Oh, is it?
Yeah. So, clinical breast examination at least. Go to a physician if you feel a lump and get it evaluated. Maybe the doctor will recommend you an ultrasound or a breast MRI if it is not picked up on a routine X-ray. But routine X-ray mammogram is not recommended in less than 40 years of age.
All right.
Yeah. So after the 40, every year.
Every year.
Every year.
Right. So, does delay make the treatment more difficult? Because you just said that by the time they reach you, it could be stage 2, stage 3. So does it make the treatment more difficult or it remains the same?
Of course, treatment changes,
Okay.
as well as more intense treatment for somebody who is presented to us in stage 3 compared to stage 2. If the lump is very big, if your surgeon is not able to save your entire breast, the you might have to sacrifice the entire breast. The entire breast has to be removed in such cases. So the type of surgery varies, and then therapy also, intense therapy. In stage 1 disease, at times you can get away without chemotherapy in hormone receptor positive breast cancer.
Oh, that's nice.
In lymph node negative, less lymph node positive, hormone receptor positive breast cancer, we do certain tests to look carefully whether patient actually requires chemo after surgery. So more advanced the disease, there is more complex the therapy is. It's for a longer period of time compared to somebody who comes in a earlier stage. Also the prognosis, once you have stage 3, 4, your 5-year survival comes down compared to somebody who is stage 1 and 2. Stage 1, actually the survival rates are to the tune of more than 90%, 92%, whereas stage 2 is again 90%. Then stage 3, it drops significantly. So it's important you screen and pick up breast cancer early so that you have less treatment, the patient has to undergo less treatment, and the prognosis remains good and survivals are wonderful.
Right. So we always say this. I've always heard everybody, all the doctors say this, that screening on time is one of the most important things. So just like you said, the treatments are better, the kind of trauma that they have to go through is lesser, and even the family has to go through lesser trauma, right? So screening is important, is all we say. So again, as we said that you mentioned that yes, in urban lifestyles, in urban areas, the age bracket is significantly going down. It's the younger women are more prone to it now. Why do you think this is happening? Why are the younger women getting more? You're getting more cases of younger women these days.
Yeah, same thing which I mentioned earlier, like westernization of lifestyle.
Lifestyle.
So most of the breast cancer is a hormonal disease. Most of them hormone positive breast cancers are the most common type of breast cancers which we come across. So estrogen, if there is unopposed estrogen in your body, because of early menarche, late menopause, not having multiple children, having a delayed first childbirth, not breastfeeding, these are all contributing risk factors to breast cancer.
Okay.
Again, sedentary lifestyle, having ultra processed food, refined sugars, and not exercising, these all contribute significantly to somebody who doesn't have a family history of breast cancer to the tune of 20 to 30%. Your lifestyle risk factors like alcohol consumption, etc., increases breast cancer risk by 20 to 30%, all together.
All put together.
All put together.
Considering, doctor, now that when you are mentioning all of these reasons, if we have to rank these, where would we rank? Say, maybe we can consider three main aspects of these. One would be late birth, having a late child, not breastfeeding properly, and an urban lifestyle. In an urban lifestyle, we will consider everything: having unhealthy food, junk food, sedentary lifestyle, or maybe lack of sleep is also a part
Lack of
it,
sleep,
right?
smoking, alcohol consumption,
So,
all of it.
yeah, so
So there's
considering this,
nothing like it's not
we
like
cannot rank
ranked. We
it.
cannot. It's a multifactorial disease.
Okay.
So it does even there is a family history which is important. So everything put together, it's everything adds together and increases the risk.
Right.
Yeah. So if you want to lower your risk, we cannot negate it. We cannot make it zero.
True.
So we can bring it down by exercising, following healthy lifestyle, cutting down alcohol consumption and not smoking, having early pregnancies, breastfeeding your children, etc. You can reduce your risk of breast cancer by 10, 15, 20%. So that's a big number.
Which is a big number, yeah. But then again, when we're talking about lifestyles, there are so many complications. As in, for an urban woman, having an early child in itself is a stigma. When we're talking about stigmas, right? So I think all of this just goes on complicating the whole thing, isn't it?
Yes, but we can choose. We can still
Yeah.
choose. What we can do, a lady can, first is lifestyle. Having processed food, refined sugars, and sedentary lifestyle, sitting in a place for and not
Ours.
exercising for
Yeah.
more than 150 hours per week. You can dedicate 1 hour per day, you know, and not smoking, reducing alcohol consumption, sleeping on time, reducing light exposure at night, that is screen usage. So all this thing helps because your circadian rhythm is disturbed because of lack of sleep. So there is a hormone called melatonin, which actually is very protective. Then you can uh, have diseases because of inflammation when this hormone levels go down.
Yeah.
Similarly, when you have obesity because of not exercising, especially central obesity, which is risk factor for so many diseases, including breast cancer in postmenopausal women, uterine cancer, colon cancer. So reducing central obesity by exercising does help.
So, doctor, when we're talking about lifestyle, and you also mentioned genetics, because when I asked you to rank these, you said that your family history comes into the picture. So, how much of a role do you think genetics play? And I've heard people say that मेरे family में किसी को नहीं था, मुझे नहीं होगा.
Family history plays a very important role. Actually, genetic factors like 10% of the breast cancers are because of certain genetic mutation in your DNA,
Okay.
which you have inherited from your mother or father. Okay, so both sides family history from the mother's side as well as father's side plays a very important role, especially if you have your first degree relative, that is your mother or sister or daughter having breast cancer, then your risk of getting breast cancer increases. And this inherited breast cancers or genetic risk is 10% only. So rest 90% of breast cancers are not inherited. So if somebody says my mom didn't have breast cancer, my sister didn't have breast cancer, my grandmother didn't have breast cancer, so I'm not going to get breast cancer, that's not true.
And when we're talking about a 10% range here, what would be the range of a person getting it inherited? Like, would we consider it to be 50-50, or maybe more chances of a person inheriting it?
No, if your mom has given
Yes.
you the gene, you have 50% chance, right?
50% chance.
Yeah, because you'll carry 50% of the DNA. And
Yes.
remaining 50% you get it from your father.
Father.
So
So there is a 50% chance there.
50% chance that if your mother has or the father has that kind of mutation, there is a risk for the progeny.
Right. So just like my previous question was that people say ki, oh, my mom did not have breast cancer, I won't get it. But there are people also who say, oh, my mom had breast cancer and I'm gonna get it for sure. Even this is not true, right? For sure isn't true.
For sure isn't true, but you don't know unless you test.
Right.
So
You should get a test.
yes, first if somebody has a familial breast cancer or familial breast and ovary cancer syndrome, we do genetic counseling and genetic testing.
Right.
Especially there is this gene called BRCA1 and BRCA2 gene. You must have heard. Angelina Jolie became pretty famous for it. She has spoken openly about it.
Yeah.
She's undergone a risk reduction mastectomy. That is, she's got both her breasts removed because she carried this germline BRCA mutation because she's an Ashkenazi Jew who have higher incidence of having this BRCA mutation. In India also we see pretty commonly and to the tune of 10%. Again, germline BRCA1 and 2 mutation. Women having clusters of breast, ovary cancers in the family, and there is male breast cancer at times, and pancreas. All these are linked to this germline BRCA mutation.
BRCA1.
So we get the mother or the incidence patients tested for this gene, and if positive, then the daughter can also undergo genetic counseling and testing.
Okay. Okay. So when we're talking about this, about testing and genetic testing, especially genetic counseling, you said, right? So one thing that I've realized that women still do not know what symptoms to look for. We just mentioned lumps. What could be another symptom that they should look out for? Is it only lumps, or there could be something else?
Yeah, most common symptom of breast cancer is a painless lump.
Okay.
Yeah,
Yeah, you
it
said
need
that.
not have to be painful. By the time the patient has pain in the lump, it's already advanced. Probably it is sticking onto the chest wall, or it is infiltrating the skin, or is forming an ulcer. So we should not ignore a painless lump. And there can be other symptoms of breast cancer, like a woman can have asymmetry in her breast. Suddenly one side of breast can increase in size, and alteration in the skin of the breast. It can appear red, angry, like skin of an orange peel. And there can be some sort of abnormal discharge from the nipple, especially blood-stained discharge. Okay. And then if you feel any lump in your armpit also, so because of the lymph nodes, some people may not appreciate the lump in the breast because of the fatty tissue. So you can appreciate the uh, lump in the armpit.
Armpit.
Yeah.
Right.
So these are the things you should look at your breast carefully, feel them, every month. That is, do your self breast examination. You can pick up a lump earlier than actually if you incidentally notice sometime down the line.
Right,
Yeah.
right. And any one of these symptoms, because I know people who would say that, oh, I don't have all of these symptoms at the same time, so maybe I'm safe, but any one of these
Any one of
symptoms,
them.
right? Right. Just like you mentioned that the lump can be painless. I mean, even if there is a painless lump, you should get it checked. But also, people think that breast cancer, once you get it, is painful. Is it always painful, even in maybe in stage two, or when should the lump be painful later on?
No, breast cancer is not a painful disease at all, unless you present in advanced stage where the tumor has spread to the bones, tumor has spread to organs like liver, or the tumor is big enough in the breast and it is actually coming out of your breast, out of the skin, or it is sticking to your chest wall. Then it becomes painful.
Okay, so people don't have to be worried about that, oh, if I get the disease, then I'm going to go through pain. Not
No, no, no,
necessary.
no, no, not necessary at all.
So, doctor, you also mentioned that women should usually do a self examination once a month at least. What are simple ways of doing self breast examination?
So you will have three different type of women now: women, premenopausal women, postmenopausal women, and pregnant women. Okay, so premenopausal women should undergo a self breast examination somewhere on the sixth, seventh day of the menstrual cycle. Okay,
Okay.
when you actually don't have those sorts of lumps which normally people get before their menses. So two ways of doing it. One is lying down on your bed, and one is standing in front of a mirror, stripped to the waist, so that both your breasts, you can look in the mirror and examine for the symmetry. Look at the nipples. Look if there is any change in the skin of the breast. Is there any change in the size? Any change in the color? Okay. Next is feel for the lump using your three pads of fingers. You have to examine all the quadrants of the breast. Breast is divided into four quadrants. Okay, then you feel everywhere properly and feel for a lump. Try and feel for a lump. Once you notice this, every month you do this examination religiously, so you can pick up a lump early, if it happens, and do it both standing as well as lying down so that you don't miss out anywhere.
Okay,
And
so
also look for your armpits also. Feel the armpits if there is any lump in the armpit. And in the postmenopausal women, fix up a date. Like since she doesn't get menses, so maybe first, second, or whatever her birthday, she examines. It just takes 10 minutes. And then in a pregnant woman, we see pregnancy-induced breast cancers too. So fix up a date, like first of every month, examine both breasts. So every month, religiously if done, you can pick up early breast cancers.
early breast cancer, if someone has early breast cancer, say at the age of 30, 35, this is where their career is beginning. This is where their life is beginning. They've in urban areas, they're recently married, and now is when their life begins. What kind of an emotional turmoil do you think they go through because they've just started living?
First is acceptance. It's very difficult to process this information that you are going through something which is life altering, life threatening. So acceptance is not easy. There comes denial. Then there comes things like too much information overload on AI, Google, WhatsApp, and probably they get misguided compared to somebody who's older, more sorted. And then they also go through a lot of emotional disturbance because probably they have small children or yet to give birth to a child or things like that. It affects mentally because as a mother, you want to live for your child more than you. And definitely these women are very, very strong and they battle fiercely. And I think it's a difficult journey, but they do develop resilience over time throughout the treatment.
Right. So now, before the whole battle begins, before the whole journey begins, they come to you. What is their first reaction if they get to know that they have breast cancer, or maybe what is the worst fear that they come to you with?
Of course, I mean, nobody's prepared for it.
Yeah.
You're shattered in the first go. It takes couple of counseling sessions. The first session goes for a longer period, and to process this information, you require family support. You require a multidisciplinary support, not just your oncologist, treating oncologist. A psycho-oncologist is involved in this process. And then, see, there is also fear of losing your organ, a part of your organ, undergoing a surgery, undergoing chemotherapy, losing hair, which is temporary. But still, for a woman, all these are things which identify womanhood. And there are more rigorous surgeries like getting your ovaries removed for somebody with hormone positive early onset breast cancer, somebody with BRCA mutation whom you want to do risk reduction surgeries. Things like this coming and one go for a patient becomes too much of information overload, too much of emotional burden. So to process this information, it's not easy. So we generally take multiple sessions. We don't bombard with a lot of information to the patient because it's not easy. So with each sitting, we discuss, we unveil things one by one.
Right. So it must be also so overwhelming for you, right, Dr. Mubeena? I mean, when someone comes to you and maybe she's very young, for you as well, it must be so overwhelming to see them.
Yes, because as a woman, oncologist, we do get more attached to our patients because these women somewhere try and relate to us, and we do provide more personalized attention to them. It is emotionally overwhelming, but we need to be brave and provide care and counseling and be strong for our patients.
Right. So in this whole journey, I'm sure not just the patient, but also, do you also counsel the family?
Yeah.
Because even they
Yes.
need it, yeah.
We have a session for the patient, with patient and family together. At times, only the family wants to discuss. 80 to 90% of your fears are conquered by having an open dialogue, good communication, and clearing your doubts and trying to reduce the fear and stigma what the patient is carrying.
Right. And again, when we're talking about these conversations, uh, what is what is it that happens if somebody is planning a pregnancy? A woman who is fertile and she's planning a pregnancy. In case of breast cancer, how does that happen?
We have seen patients who are pregnant and having breast cancer too. So we tweak the treatment regimens. We tweak in such a way that if it is a late pregnancy, we try and if organogenesis is already done, if that is the fetus organs are already formed in the womb, so we try to safely deliver the child At the same time, we try and give her something which is less toxic to the patient. So you might tweak your
Line
therapy,
of treatment.
yes, line of therapy, so that you have optimum outcomes. And yes, it's not like if once you get breast cancer you can't have children in the future. That's not true. We see women who are actually not married early on in their marital life, coming to us, who have not have children, who are thinking of having a child in the future. We actually try and do conserve their part of ovarian tissue, or you can actually do things like fertility preservation.
Oh, yes.
Yes, and proceed for your breast cancer treatment, so that most of these women are long term survivors. And once your treatment is over, these patients can go on to become mothers and lead a normal life.
Right.
Yeah, so you don't have to deprive them of motherhood.
Yeah, so one of those myths is now cleared that if you have breast cancer, you cannot become a mother. Yes, you
No,
can.
no. These women get back to their normal lifestyle. Yeah.
All right. So, one good thing is that cancer treatment has evolved tremendously over the years. And how would we compare breast cancer treatment to what it was maybe 10 years ago or 5 years ago and today?
In last 1 decade, breast cancer treatment has seen a lot of advancements. Okay, especially systemic therapy. We have more incorporation of newer drugs, that is immunotherapy in triple negative breast cancer, which was very aggressive disease. And in hormone positive breast cancers, we have new target therapy options, that is palbociclib, ribociclib, etc. These are newer molecules. Then you have this testing of germline BRCA mutation and use of drugs for them, olaparib, etc. And then newer drugs for HER2 positive breast cancer. There is a huge armamentarium of drugs for breast cancers, which is improving the survival rates. Even in stage 4 breast cancer, the lifespan has increased because of use of newer drugs. And we have more personalized therapy for breast cancer, not one size fits all. So maybe like 20 years ago, ladies to come for breast cancer treatment, you could offer them chemotherapy, max, and hormone therapy. There was no target therapy, immunotherapy, anti-HER2 therapy 20 years ago. So we have so many treatment options now.
Right, and I'm sure all of this, and because you said it is personalized, it also makes them feel more comfortable, right? It makes them feel.
Yes. So it will be designed precisely for some treatment for a 30-year-old lady coming to me with breast cancer, with a triple negative breast cancer, is totally different compared to a hormone positive breast cancer lady who's coming at the age of 70. There is a very, very different treatment. So you cannot compare, The side effects may be different, drugs will be different, the treatment regimens will be different, the course, number of months of therapy will be different in both these individuals.
Right. Could you also help our listeners understand how treatment decisions are made depending on the type and stage of cancer? Because you just spoke about the age and different types of treatments that we have.
So breast cancer is not one disease. Breast cancer has different subtypes. There is a hormone positive breast cancer, there is HER2 positive breast cancer, there is a triple negative breast cancer. So hormone positive breast cancers are considered slow growing tumors traditionally. They have good prognosis. They don't require very intense treatment, and the survivals are very good.
Okay.
HER2 is intermediate, slightly aggressive compared to hormone positive breast cancer. Risk of relapse is higher, and you require a longer therapy and use of newer drugs. Triple negative breast cancer is the worst, less incidence compared to these two, but response to treatment, that is recurrence chances are higher here. So it's one of the most aggressive forms. You need to use multiple treatment options for achieving cure, and these women are under very good surveillance after completion of therapy.
Right, so they'll stay under surveillance for a longer time also.
No, the relapse rates are earlier and higher. So first 2 years are very crucial in them. Whereas in hormone positive breast cancer, relapses happen after 5 years.
Oh,
Yeah, so there's a difference.
it's a difference. So, when early detected, are the outcomes generally very positive today?
Yes, very, very positive. More than 90% cure rates.
Oh, that's amazing. That's brilliant, right?
Yes.
So, as an oncologist, what gives you the most hope right now in breast cancer care?
Use of so many new molecules, personalized therapy, reducing the toxicity for the patient, and improving outcomes. They do well, they live longer life, and their quality of life is not impaired, and they go on to have children, and they are just one amongst us. So that's very, very positive.
Before we finish, let me quickly run few common myths. Like we just busted one myth. Let's just talk about a few myths. All we need to do is true or false, like a rapid fire true or false. So let's start very quickly. Breast cancer only happens if there's family history.
No myth.
If a lump is painful, it's cancer. If it is painless, it's harmless.
No, it's a myth. Most of the breast cancers are painless.
Young women do not need to worry about breast cancer at all.
No, no, no. Everybody should be aware about breast cancer.
A healthy lifestyle guarantees protection from breast cancer.
Of course, it does. It doesn't guarantee, but it definitely reduces the
Reduces
risk
the
of breast
chance.
cancer.
A breast cancer diagnosis is a death sentence.
Not at all. Not at all. It's not a death sentence.
Breast cancer can happen only to women.
It's a myth. It can happen to men too, but the incidence is very, very low.
Okay,
1 in 100 out of whatever breast cancers we see.
right. So, well, I'm done with this part. Very quickly, I wanted to know, do men also have to go through the same self diagnosis, or they can, right?
Yeah, generally men don't have much breast tissue. So any lump, they can feel it.
They can feel a lump.
Especially breast cancer in men is more common with, again, these mutation risk factors. So somebody who has a mother, a sister with germline BRCA mutation, they themselves should get tested
Okay.
so that they know what their risk is.
So, before we wrap up, very quickly, if a young woman is listening today with no family history, no symptoms, what is one thing that you would want her to remember? And what is one practical step that she can take?
Self-breast examination and being aware of your risks and following a healthy lifestyle. I think you are going to reduce your risk, pick up something if it is early, and don't be stigmatized. Be a warrior, be brave, and please seek medical attention on time.
Right. Thank you so much. Thank you, Dr. Mubeena. We had such a great conversation. I learned so many new things today, and especially the myth busting part. I think we already cleared it in our whole conversation, but still, I thought we'll do a quickie one. And thank you so much for being with us here. Thank you for our viewers. They all needed to know so much, and thanks for your time.
Welcome, Ekta. Thank you. You are a very warm host. Thank you for making me comfortable and having this session here.
Well, early detection really does make a difference. Know what is normal for you. Do your monthly self examination and don't skip that clinical check when the time comes. If you found this episode meaningful, then please share it with someone who you think should also listen to it. Once again, I would like to thank Dr. Mubeena here and thank you all for being with us through this episode. This is Ekta Kapoor and this was the Cancer Conversation with Delarc Pharmaceuticals.